Everyone, and thank you for helping me on shooting this video. So guys, I'm trying to introduce for you the machine, and I'm trying to make it oversimplified. This is your first day in our department and you want to use the machine. So first of all, make sure that it's plugged to the electricity. You don't want to, in the middle of your exam, that it's shutting down. So it's actually keeping it high down there, okay? So you might see another plug in here. This is the one for printer, and this is the actual one for the machine. In the back here, I'll show you where the probes should lift. So ideally, if this probe lifts here, it will fill off, and it's the most expensive piece in the machine. So we want to keep it clean and keep it safe. So this is where it lifts. Kindly, it's not civilized to leave some blood or dirt on it, so this is why we're hanging the decontamination wipes here. Okay, so these are the probes. This is called curvilinear, and this is called cardiac probe, and this is superficial or vascular. Curvilinear, most of the time we use it for the abdomen, and we'll go through this in detail. This cardiac probe, obviously, this we use for the heart. Vascular, a lot of uses, sometimes for superficial structures, mainly vessels and vascular access. Moving on, to start with, where we position the machine. Ideally, if you are right-handed, you like to scan with your right hand, and the machine will be on your left hand. So you will write the machine with your left hand and scanning with the right. So there is no rationale to keep the machine on the left of the patient. We keep it on the right hand of the patient. Same thing for ergonomic point of view. If you are scanning, there is no reason for you to be leaning forward on the patient. You need to make yourself comfortable sitting there, scanning with one hand, other hand. Another piece, it's a bit important, to having gel. So there is no way you will be scanning without media to transfer the waves so we can see on the machine. So make sure that you have gel and it's full so you can use it. And this is the sterile one. If you are doing a procedure like vascular access, you will use the sterile one with the probe cover. So moving on now, the machine is closed and connected. I'm sitting. I explain to the patient in a second. The starting, the power button is here on the right side of the machine, okay, and the USB on the other side. If you want to extract your images, it will be there, and there is HDMI cable as well, but rarely we use it. So now we start the machine, and the first button there is unfreeze. So the freeze the machine to save battery, so it will be unfreeze. So this is we starting now. But a few points to highlight here. This is the battery health. This is the Wi-Fi, and when you transfer any data, it will be showing a wave here, blue wave, and this is the space you have on the machine. So if you have like 97 or 98%, your images will not be recorded. So it will be a good habit to make sure what the use the space or what's the empty space. Before starting, we need to make sure that we put the right patient details. Some machines will have barcode reader, and this will scan the wristband of the patient, and all the details will come here, and you can put your name as operator. So it will be easy for you to record the images and come back. Once we've done this, because we didn't scan, so we didn't put any patient details. Second thing is choosing the probe. So it depends on our exam. So let's start with, I'm doing fast scan, so we'll have here adult abdomen or EM fast, for example. And we have the AAA, we have obs and gynae, lungs. So these are the settings which help us to get the best optimized image. Same applies for the cardiac probe. And by the way, you can use this probe for multiple uses. Coming to vascular probe, so mainly it will be the superficial and you can use it for the vascular access as well, and you can use it for lung, testicle, and per breast. So this is not chill. What are the common uses for these probes? To start with, we'll explain to the patient now. While I'm explaining to my patient that I will scan him or her, so I explain to them it will be very cold. For some reason, the gel is very cold, so I'll expose the area what I'll be scanning. Usually, all of us will start with the Morrison pouch for fast scan. For some reason, the flanks are quite sensitive for cold temperature or cold gel. That's why I start usually in the front of the abdomen and slide posteriorly, and I explain to my patients that it will be cold, so they will not be jumping from the bed. Now, I have the abdominal or curvilinear probe in my hand, but I have here the setting for the vascular, so I need to choose the right probe, which is abdomen, and pick this one, and we'll start scanning. So we'll start with the anterior, and when we see the image here, there are some parameters we need to change. So we have the gain on the right hand side, and we have the depth. So first we'll play with gain, and as you can see, the more we go up, or the less gain, the more bright the image. So let's correlate this with what's called TGC, which is multiple level gain. So for example, if you have here bladder or any fluid, there will be a lot of enhancement behind it. So you can change actually the level, which level of the screen you want it to be bright and which you want it to be black. So again, the gain is overall the darkness and brightness of the screen in simplified language, and the TGC is for the level. So you want some level to be dark and some level to be brighter. So again, for the depth, what we want to do is avoid all the dead space, and depends on like what is the depth of your organ. So if you are talking about scanning vessel or scanning appendix will be quite superficial, so you don't need all this dead space. So I'll get rid of it. Okay, I prefer to start deep, so I'm not missing anything. Then I'll go to the depth I want. Make sure that I have the landmarks with me. Correlate with this is the focus. The focus will give us more details on the exact one level. So it's kind of either 5 centimeter, 3 centimeter, whatever. And talking about centimeters, each space between two lines represents 1 centimeter. If you want roughly stating, okay, yes, I can see this aorta, and the aorta is 1, 2, and 3 centimeter, for example. Okay, so we talked about the gain and depth and the TGC. Moving on, and we talked about the patient details and the probe. And here, the most used mode will be the B mode, which is basically the brightness mode, and we use this like for 80% or even 90% of our cases. Moving on to the color. So the color, if you are examining vasculature, for example, if you want to differentiate between torsion and the testicle, other causes for testicular pain like varicocele or adenomorchitis. So if you scan the testicle and there is no blood going there, it means it's avascular. It means there's torsion. So using the color. And if you want to use for the DVT as well. Pulse wave, if you want to make sure this is artery or vein, you see the spikes for the artery, and you see the steady wave for the vein. So a bit advanced. M mode, mainly we use it for the sliding of the lung pleura, but let's focus on the basics now. We are using the B mode. Once we want to save any image, we use either save image or save clip, and you can stop after a few seconds if you want, or get the full clip. So if I stop here, it will be 3 seconds only, but if I leave it, it will be 8 seconds. Okay, and we can adjust this. You can decide what length of the clip you want. Whenever you want to get a measurement, we freeze first, and then we get the measurement from here and down there. Make sure that you are perpendicular, and you will get the distance there. Okay, thank you for this. So when we do a procedure, what will be the ideal position for yourself and the machine? If we are talking about putting a peripheral ultrasound guided line. So I'm having the probe here, so finding it difficult to use my right hand, so I'll use my left hand, which I'm not familiar with. Then the machine on my right side, so I'm looking to the right, then look to the left to the patient. So it's not an easy, I'm not making my life any more easy, so it's kind of difficult and end up by failing to put the line. So why we don't change the position of the machine and see how this goes? Changing my position now, it's one axis, so the object of the procedure or the patient arm and one line with the machine. I'm using my left hand comfortably and using my right hand for putting the cannula. So I can move the probe easily, I'm in control and I don't move my head, so I'm not losing the sight either for the patient arm or the machine, so it's all on one side. So try to keep in mind that you need to be comfortable doing any procedure to maximize your chances in progress or in success. So if you are doing the central line, you need the machine and the probe to be on one line. So it should be easy if we change the machine to be there. And I'm standing here, scanning from there, looking to the machine in one direction. The same apply to any procedure. So make sure you put the probe or the patient and the machine on one line rather than moving to one axis to another. Thank you.